Tell me what democracy looks like. Tell me what democracy looks like. Tell me what democracy looks like. You're damn right this is what democracy looks like. In the words of the ACLU, democracy is messy, loud, and disruptive, and it is not a spectator sport. Thank you for coming out today. My name is Matt Purinton. I work with an organization called Upstate 100. Let's also remember on this patriotic holiday that dissent is patriotic. And when politicians and corporations get together to write legislation that will hurt our brothers and sisters, it is our civic responsibility to dissent. And that's exactly what brings us here today. The GOP is trying to push through a cruel and devastating bill disguised as a health care bill.
Tax cuts.
That's right.
Wealth care.
How can you call it health care? It's a wealth care bill. It's a heartless and immoral bill that will be devastating to working class people like you and me and poor people.
23 million.
That's right, man. Our first speaker today is the director of the South Carolina Appleseed Legal Justice Center, an organization based out of Columbia, South Carolina, that for 37 years has been fighting for low-income South Carolinians on multiple issues like housing, education, hunger, domestic violence, health care, and immigration, just to name a few. So why don't you please make her welcome Sue Berkowitz.
Well, thank you, Greenville. Thank you for all you're doing. I wish I could be up here for everything that you're doing because it's so exciting to me to see people engaged in fighting on behalf of others here in our state. Because it is a fight. We're in a fight for our lives.
It's true.
Health care should never be a privilege. It is a right. At South Carolina Appleseed, we fight for a lot of issues. But health care and immigration rights are the two that we've taken on this year because we cannot let anything happen to both our immigrant brothers and sisters, but also to all that we've been able to do to move forward in the area of health care. The Affordable Care Act has helped millions and millions of people in our state, in our country, and hundreds of thousands of people in our state. Well, we could have done better in South Carolina if we had expanded Medicaid. If our governor had not decided to make political decisions about health care and had made sensible decisions about health care, we could talk about how, like other states, we had only single-digit uninsured. But the fact that we have gone from almost 20% uninsured down to 11% says the Affordable Care Act works. And Matt, you're flying away. Healthcare for me is very personal because I had a child born with the audacity to have a pre-existing condition. It wasn't a life-threatening condition, but it was a pre-existing condition. And when he was 2 years old, we lost our health insurance. We lost it because back then Speaker Newt Gingrich decided that people who were poor shouldn't have lawyers to help them. He had a thing called, remember the Contract on America? Yes. Well, we were one of the hits. And I lost my health insurance. And my family lost their health insurance. But I knew that at least I could try to get health insurance as a private citizen if I couldn't have it through my organization. And we applied for it. And we were told that my 2-year-old son was uninsurable. What kind of country allows a 2-year-old to become uninsurable and allow insurance companies to tell you they're uninsurable? That's what we had. And then President Obama pushed through the Affordable Care Act. And it was a bipartisan effort in the beginning. Despite what we hear from our senators and our congressmen, There were 15 months of hearings. There were numerous amendments put on that bill. And we ended up with something that was considered a compromise. Not everybody was thrilled. Personally, single payer would have done it for me. Yeah. But you know what?
That's right.
We'll just have to work on that a little later.
Yeah.
But what made me happy is that I looked at my son, who was 16 at the time, and I looked at him and I said, and I cried. And I cried for all the folks that we represent in this state that call us all the time and say, how do I get health care? But I also cried for him because I knew no other 2-year-old was going to be turned down for health care, and that he, whatever he decided to do, couldn't be told by an insurance company he was uninsurable. And what happened after the Affordable Care Act passed? The majority in Congress have been trying to repeal it ever since. Despite the fact we have millions of people who are now insured, despite the fact in many states with Medicaid expansion, we have poor people, people who are working poor who are now insured. Despite the fact that we're now seeing health care costs for people who are, for women, who are no longer considered a pre-existing condition by their gender, able to get health care. We're able to see people who want to have a child have access through their insurance for maternity care. It isn't an option, it has to be provided. And why are they trying to get rid of this? For one reason only.
Money.
For money. Absolutely for money. When the American Health Care Act got passed, everybody thought it was going to be passed on January 21st. But it didn't. Why? Because of you. Because you went out and you told Congress this is not right. And they had to struggle and fight to get that bill passed. What should have been a slam dunk in a majority Republican House of Representatives. Then they came over to the Senate. And our senators said, all of them said, oh, we're not going to accept this bill. Even Trump, after he celebrated in the Rose Garden and called it mean, 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 said, oh, well, they're going to start from scratch. And how did they start from scratch? They went behind closed doors. 13 white men went behind a closed door, and they came up with something that looked awfully similar to the American Health Care Act. And they wanted to shove it down the Senate's throat. But you know what? It's not that easy, is it? Why? Because we called them out on it. We called them out on, you say you're not getting rid of pre-existing conditions, but you're going to have a premium on it for people if they don't have insurance and try to get insurance. So there really is going to be a cost for pre-existing conditions. For folks my age and older, suddenly, in order to get insurance, it's going to be 5 times more than it would cost someone who's in their 20s. They want to get rid of basic health benefits. Because heaven forbid we should say health insurance should always provide maternity care. Let's stop saying that we want to get rid of things that make health care expensive. Health care is not cheap because we don't do it right here in America. We should do single payer, but what we shouldn't do is go backwards. We know 23 million people are going to lose their benefits, and a lot of those folks are going to be Medicaid beneficiaries. Did you know 1.1 million people in this state are on Medicaid? That's almost 25%. They will be at risk. Senator Scott, in an article in the state paper today, you ought to look it up, he said, oh, it won't hurt anybody in South Carolina because we didn't expand Medicaid, so no one will lose it. I say to you, Senator Scott, if you can't read the bill, you better get staff who know how to read that bill. Because people will lose their Medicaid. When they cap Medicaid, it's going to be old folk against kids. It's going to be the disabled against providers getting their increase. And if you think it's tough to access health care now, if they do what they plan to do to Medicaid, it will become near impossible. This bill isn't about the Affordable Care Act. Why is Medicaid even in it? Right. This is about taking $772 billion over the next 10 years out of Medicaid, so the top 1% can get a tax cut. So while I can't stay here and be up all night with you, let Senator Graham know. He has to know. And tell your story. I tell my son's story all the time. He's all fine and healthy now. He's actually a medical corpsman taking care of others. And I'm proud of him. Thank goodness he's getting out soon, absent the election, but I'm proud of him. Because you know what? He doesn't deserve to be turned down, and no one deserves to be turned down. I don't want to have to tell one more mother who calls me and says, I don't know how to get services for my child. I don't want to have to tell one more woman who calls me who's been diagnosed with cancer, and it's not the right kind that Medicaid will cover, that she's not going to get coverage. I don't want to have to tell someone who can't afford their medication that, well, too bad, go elsewhere. And all of these things are going to get worse because many of these are optional. Did you know prescription drugs are optional under Medicaid? It's not mandatory. So when you're told you're sick and you're going to die, they'll tell you, but they won't be able to give you the medicine to make you better. That's not the America I live in. It's not the South Carolina I want to live in. And so keep making your calls. And remember, this is a long fight. We're going to fight the Senate effort, but it's not over. We've got a lot of work ahead of us. And you're inspiring me being out here on a hot day in Greenville. I need that inspiration. I get tired sometimes. We feel a little lonely sometimes doing our work. We're so glad that we're here with you and that we're all going to be doing it together. Anytime you need us, you call us. Matt's got our little rat card. Sign up for our news alerts. We'll tell you what you want to know about the issues, if there are issues that we're working on, especially healthcare, especially immigration. We'll tell you what's going on up at the State House when they come back in, because we got to keep our eyes on them too. But we want to work with you because together we're going to beat this stuff. Thank you so much.
In this country.
I don't even know if I want to comment, honestly.
All right, we're going to get another speaker up here. This is a guy I just met down at the Every Tuesday protest. I don't know if you know this, but every Tuesday from 12 to 1, which is where I know a lot of y'all from. Met a lot of great people down there. They go down in front of Graham's office from 12 to 1, and they protest and they raise hell, and peacefully. And they go up into Graham's office and Scott's office and Gowdy's office, and it's just a really good scene. I think they had 50 people there this week. We had a die-in a couple months ago when the House put out their health care bill. We had 75 people down there. So anyways, I want to introduce you to a friend I met down there. He's going to talk to you a little bit. He's a larger-than-life character. It's my good friend Carl Rudd.
So just as a point of clarification, the previous speaker talked about prostate exams. I've had one. Just in case there was a doubt, somebody had a question. Now there's that die-in later tonight. For those of you who maybe are older, maybe older than I am, you have a hearing aid, it's not a tie-in. You may have a t-shirt from that area if you want to wear it. My wife threw mine out decades ago. But you're allowed to wear it, that's all right. So how do you know you're getting older? Well, I have children that love to discuss existential issues with me. I mean, I raised them, it's payback is really hard. You know, so my oldest daughter, she's 44 years old, and she calls me up on the phone, Dad, you know how you're getting older? I said, oh God, here it comes. Here it comes. She goes, you know you're getting older when your children are midlife. And I told her, I said, you know, that says as much about you as it does me. And then she hung up the phone on me. I have no idea what that was about. So I'm going to tell you a story about my journey with health. I'm just going to go back to April of 1999. I was working at my machine. I was a machinist all my life. And I was standing in front of my machine and I hit the ground. Bam! Concrete floor. I had an epiphany. I was down there, I was looking at that concrete. I said, somebody's got to clean this stinking floor. And number two, does anybody have any morphine? I was in pain. I had never experienced that kind of pain in my life before. I went to my doctor and said, well, you got a prostate infection. Here's some, elevated white blood cell count. Well, for the next year and a half, I kept on going back to my doctor. Started getting painkillers. I was off them, then I was on, and by the end of the year and a half, I was on them full time. I was diagnosed with phantom pain. What do you do with phantom pain? I told my doctor, I said, I wish you told me I had cancer. I can see that. I know what to do about it. I know that you know what to do about that. Phantom pain. So I went and saw 4 specialists. I saw my family doctor, a urologist, an internist, and I had an autopsy. Which, by the way, is a really great way if you're late for work one day and say, why were you late? Well, I had an autopsy. They didn't find anything. Okay, it's a really great thing to do. Of course, for me, if I had a brain scan, I could say, no, they didn't find anything. There was nothing there. So as I got toward the end of this year and a half, I was on 10 milligrams of Oxycontin twice a day to deal with the pain. Phantom pain. So my wife took the kids down to Atlanta. This was September 8th of 2000. She asked me, can you come with us? I go, no, I'm really not feeling well. So every 12 hours I was taking my Oxycontin. That Saturday on September the 9th, the pain started escalating. It grew and it grew. It was like torturous pain. So I took my Oxycontin at 7 in the morning, 7 at night, and the pain was escalating. So I thought to myself, well, maybe I forgot to take it. You get older, you forget. So I took another one. 30 minutes later, the pain was still escalating. Unbelievable pain. Called my doctor up, said, look, I've taken 40 milligrams of Oxycontin. He about hit the floor himself. He said, no, you can't do that. I said, I'm in pain. He goes, you can't do that. So the next thing I thought to do, so I took about 20 or 30 milligrams more, and my hands were shaking so bad I couldn't even dial 911. That's pretty bad. So I did the next best thing that only an intelligent male would do. I got in my car, and I drove to the hospital. I didn't say I was smart. I was desperate. So here it is, September 10th, 1:30 in the morning, Allen Bennett Hospital. Some of you remember Allen Bennett Hospital. They used to call it the veterinary clinic in Greenville. I'll tell you, they saved my life. They saved my life. But I'll get there, I see some nurses out here. You guys are angels. Woo. Unbelievable, you guys are angels. So 1:30 in the morning, I'm running to the doors. I don't know if I was running, it was horrible. I ran to the doors and bam, I hit the doors and the door like this, and I hit the ground again. And I had my second epiphany. I looked at that concrete floor and I said, somebody needs to clean this concrete floor, and could you please get me some morphine? They were all out of morphine that day. So the nurse comes out, she sees me on the ground, says, are you all right? I mean, I want you to, use the nurses. Okay, I'm on the concrete floor. It's on the, are you all right? The answer to that would be no, I'm not all right. So I went into the doctor, gave me a shot of Demerol. I said, I'll be back in 15 minutes, the pain should go away. He came back in 20 minutes. I never believe the doctors anyway. Pain didn't go away. He gave me another shot of Demerol. Pain did not go away. He came back, he says, I can't give you any more. So I did the only gentlemanly thing I knew how to do. I gently grabbed the hold of his shirt, put his face in the proximity of my face, and said, either you give me something or we are both going to be in a lot of pain. So he said, I'll be back. So he went and made a phone call, and he came back and gave me a couple more shots, and then I could tell him what was going on in the last year and a half. That unbelievable pain. Now I had help.